One of the things that I get asked a lot is, do I prescribe body identical hormones? Yes, I do. Because the hormone replacement therapy that is licensed for use in this country is body identical. The majority of hormone replacement therapy, in fact nearly all of it, contains estradiol, and that's exactly the same compound that your bodies make. It's one of the more potent estrogens. The ovaries make estradiol, estriol and estrone. But estradiol is the big powerhouse, which is why we use it in HRT. It's also the same that estradiol compound, a chemical compound that can be derived from misogyny, which is found in yams. So when people say to me, have I got body identical HRT? I say yes. If you want to get it from yams, you need about 3 or 4 tractor loads, or possibly even more. I'm not exactly sure how many. And somebody that can turn the misogyny into estradiol, or you can take a patch or a tablet. I think the latter is actually simpler. We also need progestogen, a progestogen, and there's lots of different types of progestogens, okay? These are the ones that are associated with the differing rates of breast cancer, and I've talked about that at an earlier talk. But the ones that I prescribe are what I call the nice ones, and there's one in particular which is definitely body identical. It's exactly the same as our ovaries make. There are clinics that you can go to that do prescribe tailor-made body identical HRT. It's generally not licensed, and often the people that prescribe them are not members of the British Menopause Society. The British Menopause Society does not recognise these compounds and these drugs. But they're special for you because I had a blood test and they tailor-made me a lozenge or whatever. Okay, but if you do a blood test later on in the day, that's actually going to be a different value because all our hormone levels fluctuate quite differently, and so you probably need to buy another lozenge. And what you have to remember is that the body identical hormones, which we call non-regulated, as opposed to the regulated ones that members of the British Menopause Society and the majority of doctors do prescribe, which are regulated. The ones that aren't regulated are quite simply not regulated. So you don't know, you can't guarantee that what you get one week is going to be the same as what you get the next week. They're not regulated by the MHRA, and we don't know their long-term safety. So I certainly wouldn't advocate their use. So to put it in a nutshell, British menopause specialists such as myself do prescribe body identical hormones which are regulated and safe for life.